Hi everyone, Teresa Net again for the second capsule. Today we're going to talk about aches and pains. This good news of being pregnant also comes sometimes with some minor issues, sometimes a little bit more serious. So we're going to talk about, some very common issues to some much more dangerous ones. So let's start with dental pain or gingivitis. It's a very, very common issue and not always talked about. So this is important that we mention that. Because of hormones, increase in blood flow, there's a very sensitivity to your gums. You might notice when you floss that your gums are bleeding a little bit, which is totally normal, nothing alarming. For that reason, however, it's important to use a soft toothbrush because you don't want to irritate your gums. And we recommend as well that you see a dentist or a hygienist to have your teeth cleaned. Please continue to floss and make sure that you brush your teeth twice a day. Also, all women experience some kind of bleeding, so you're not the only one. Headaches. Again, hormones cause some slight headaches. We're going to talk later about severe headaches. But if you experience headaches that disappear when you go for a walk or when you rest, not to worry, it's due to hormones. You can also take medication that is prescribed by your doctor, or the pharmacist will tell you what you can and cannot take. So eat healthy, exercise, rest, especially at the beginning when you feel fatigued. So you need to sleep, eat well, and it will get better after in the second trimester. Heartburns and indigestion. We already talked about the problems with reflux and nausea, but during pregnancy, throughout the pregnancy, as you get closer to delivery, you might experience some discomfort when you eat, due, of course, to the weight of the baby. He takes a lot more place in your stomach, in your abdomen. So the same recommendation goes, eat small amount at the time, and also eat more often. Again, avoid fatty food, sweet foods, spices. You can also elevate your mattress. That really helps. Don't use pillows. Some people say, well, I added 2-3 pillows in my bed. That will only cause some pain in your neck, not necessarily help with digestion. So you can use a wedge to put under your mattress. So this is really important to make sure that it helps you with digestion. Also, you can rest, but wait 2 hours after your meal to help you feel, like I said, to help you with digestion. Varicose vein, very common again. It is due to the pressure of the baby on main veins that causes some people are more prone than others. So you can avoid standing up for long periods of time. Elevate your legs when you have a chance. And you can also sleep on your left side, which will help the circulation. Some women also wear some prenatal hose, special hose pressure that helps the return of the circulation of the blood. So another common issue is leg cramping. So that happens mostly at night. We're trying to get some sleep. So what is really efficient is to actually lay down on your back and flex your foot towards you. So you pull on your toes towards the ceiling, and it usually releases the cramp. Walking also helps, and massage. Don't worry, there's not going to be some permanent damage to your legs. Constipation, something else that is very common and not really a great thing to deal with on a regular basis. So you can increase. We all know that fiber really helps. Drink water. Again, if you have other issues with digestion, drink water in between your meals. Again, you're going to hear me say that. Exercise. Walking is extremely good it helps the movement, and it will really help you feel better. If it doesn't get better, you can talk to your pharmacist, to the nurse at the CLSC, to your doctor to see what treatment is better for you. Sciatic nerve. the pain that a lot of women have when they're pregnant as you get towards the end of your pregnancy, again, due to hormones. So what you can do is, I know you're going to say, she said it again. Yes, exercise. Exercise really helps. When you do the exercise on the floor I mentioned in another capsule, the cow and cat position really helps. Sometimes the doctor will refer you to a chiropractor or a physiotherapist because it can be very painful. Fluid retention. So very normal to have fluid retention, not to worry about if your blood pressure is not increased. It's worse in the summer months, so you may feel like you're very uncomfortable. So to help with fluid retention is to elevate your legs again. And also, I would recommend that you limit your salt intake, sodium, and avoid processed food because there's a lot of salt in processed food. Be cautious also when you go shopping, read the back. Because the sodium shouldn't be more than 15% of your intake. So sometimes it's hidden sodium and we're not aware there's a lot in our food. So the liquid, sometimes we say, well, if I drink more water, I'll have more fluid retention. Actually, it's going to help flush the fluid so you can drink between the meals. So the blood pressure, I mentioned, if your blood pressure is higher than 140 over 90, that's considered high blood pressure. So if you have, if you measure your blood pressure and it is high, you absolutely need to talk to your doctor or even go to the hospital. Diabetes. Now we're getting to the more serious stuff. Again, diabetes is fairly common and it's caused by hormones from the placenta. So if your sugar has a tendency to be high in your blood, sometimes it's a condition that will be experienced during the pregnancy. But after the pregnancy, more often than not, it completely disappears. It doesn't become chronic. So what really helps for high sugar in your blood, it goes without saying that you'll have to have a strict diet. So no sweet, no pop, nothing that will increase the sugar in your blood. You'll have a very tight follow-up with your doctor as well. And you may have blood tests at the CLSC to check on your sugar and to see how you're doing. If ever it doesn't get better, there might be medication prescribed to help you deal with that and make sure that it's stable. The complication of diabetes is a big baby, like higher weight at birth, and because of that, there might be a C-section that is recommended. So throughout your pregnancy, very important to follow the diet and respect also what the doctor is telling you to do. Another condition that is very severe, that could become very severe, it's preeclampsia. Preeclampsia is a condition that we don't really know what causes preeclampsia. So the signs of preeclampsia are high blood pressure. You could have blurry vision. You can have also experience pain under your breast line, back, abdomen. You can have severe headaches. Feel like you can't breathe. Some people also have swelling, but very sudden. I'm not talking about the normal swelling. I'm talking about sudden swelling in your face, hands, ankle. If that ever happens to you, you absolutely need to consult, call an ambulance, but you need to go to the hospital. This is very dangerous for you and for your unborn baby. So any of those signs, you go to the hospital. So that's it for this capsule. Hope you enjoyed it, and we'll see you next time.